What to know about radiation therapy? Radiation therapy is a treatment for cancer and, less commonly, thyroid disease, blood disorders, and non-cancerous growths. In this video, we will discuss what is radiation therapy, its side effects, uses, and types of radiation therapy. Before we proceed to this video, don't forget to click the thumbs up button, share to your friends, and subscribe to Earlyseven YouTube channel for more radclusive videos. What is radiation therapy? Radiation therapy uses waves of energy, such as light or heat, to treat cancers and other tumors and conditions. The form of radiation used in cancer therapy is a high-energy type known as ionizing radiation. A doctor may recommend radiation for cancer at different stages. In the early stages, radiation therapy can help reduce the size of a tumor before surgery or kill remaining cancer cells afterward. In the later stages, it may help relieve pain as part of palliative care. One form of radiation treatment involves using a machine that produces a beam of radiation. The beam targets a specific area of the body. Another type involves putting a radioactive substance inside the body, either permanently or temporarily. Sometimes a doctor prescribes radiation therapy alone, but usually, they recommend it in combination with other treatments, such as chemotherapy, surgery, or both. What are the side effects of radiation therapy? Radiation can affect healthy cells as well as cancerous ones. When this happens, a person experiences side effects. Specific side effects depend on factors such as 1. The area receiving treatment, 2. The person's overall health, and 3. The type and doses of radiation. Short-term side effects. Short-term side effects vary, depending on the part of the body receiving radiation. Side effects include fatigue, hair loss, diarrhea, skin changes, nausea, and vomiting. A study published recommends screening for anxiety and depression in people undergoing radiation therapy and offering counseling services to those who may benefit from them. Long-term side effects. Long-term side effects also depend on the treatment side. They include 1. Heart or lung problems, if radiation affects the chest. 2. Thyroid problems, leading to hormonal changes, if radiation affects the neck area. 3. Lymphedema, which involves lymph fluid building up and causing pain. And 4. Hormonal changes, including a possibility of early menopause from radiation in the pelvic area. There is a slight chance that high doses of radiation in certain areas can increase the risk of another form of cancer developing. A doctor will provide more specific information and help with weighing the risks and benefits. Not everyone who has radiation therapy experiences long-term side effects. The risk depends on the doses, the area of treatment, and other individual factors. Types of radiation therapy. There are two types of radiation therapy: the external beam radiation therapy and the internal beam radiation therapy. External beam radiation therapy is the most common type. It involves an external machine emitting a beam of radiation that targets the treatment area. Different forms are available, depending on the need. High-energy beams, for example, can target cancer that is deeper within the body. There are different types of internal radiation therapy. Both involve implanting or introducing a radioactive substance into the body. Brachytherapy involves inserting a radioactive implant in or close to the cancerous tissue. The implant may be temporary or permanent. Another type of internal radiation therapy involves drinking or receiving an injection of radioactive liquid. The goal is to limit the extent to which healthy tissue around the cancer is exposed to the radiation. Doctors may recommend this treatment for prostate or ovarian cancer, for example. A doctor may recommend undergoing both main types of radiation therapy. The decision will depend on 1. The type of cancer, 2. The size of the tumor, 3. The tumor's location, including the types of tissue nearby, 4. The person's age and overall health, and 5. Other treatments. What to expect in radiation therapy? The doctor will discuss radiation therapy and other options and help weigh the pros and cons. Before treatment starts, they will determine the right type and dosage of radiation. A person receiving external beam radiation may undergo a CT or MRI scan before treatment. This is to pinpoint the exact location and size of the tumor. A doctor may make a permanent but small mark on the skin to ensure that the radiation therapist will target the beam correctly. Radiation therapy is painless, but there will be damage to surrounding tissue. This is why the treatment occurs on only 5 days per week. The 2-day break allows for some healing. A person who has internal radiation therapy may require an anesthetic before the doctor can implant the radioactive substance. The details of the process depend on the type of radiation therapy and the type and location of the cancer. Uses of radiation therapy. Radiation therapy can help shrink tumors and kill cancerous cells in the early stages. Radiation therapy can also help treat symptoms when cancer has spread widely. At this point, the radiation is part of palliative care, which aims to relieve a person's symptoms and improve their quality of life. Palliative radiation treatment usually involves lower doses and fewer treatment sessions than curative treatment. Other ways that palliative radiation treatment can help include: 1. Relieving pressure or a blockage by reducing tumor size. 2. Treating symptoms of brain cancer, such as headaches, nausea, and dizziness. 3. Reducing symptoms of lung cancer, such as chest pain and breathlessness. And 4. Controlling ulcerating tumors, bleeding, and infections. In people with head and neck cancers, an obstruction in the superior vena cava can affect the return of blood to the heart. Radiation therapy can help relieve this. If you enjoy watching this video, don't forget to hit the like button, share to your friends, and subscribe to Earlyseven YouTube channel for more rad-clusive videos.